Hello everyone! We're back again in this mini-series to talk about another group of personality disorders, this time in Cluster B. As mentioned in our first video, many of these conditions are associated with negative stereotypes in pop culture, leading them to be stigmatized and poorly portrayed. Antisocial, borderline, histrionic, and narcissistic personality disorders are but a few examples of these. The first condition we'll cover today is antisocial personality disorder, in which a person does not differentiate between right and wrong while antagonizing others. These characteristics often lead individuals to violate the law through destruction of property or theft, for example, as they often do not understand the moral limitations of society. People with antisocial personality disorder do not believe that they need help, and when they do seek it, they may not provide an accurate account of their condition. Psychotherapy can help manage this disorder through anger management and treatment for substance misuse, but is ineffective if individuals do not admit to their symptoms. Borderline personality disorder is the second of the four in Cluster B. BPD causes problems functioning in day-to-day life as it creates an intense fear of abandonment or instability for individuals. BPD is characterized by frequent mood swings, unstable relationships, impulsive behavior, and more. BPD is also one of the more poorly represented disorders in pop culture, as many TV shows use it to portray misunderstood characters while romanticizing symptoms such as suicidal ideation. Again, psychotherapy has been proven to be effective, but specific types like dialectical behavioral therapy or schema-focused therapy are more geared to BPD individuals. Next, we will cover histrionic personality disorders. HPDs can be classified as a mental health condition pronounced by unstable emotions, a distorted self-image, and a desire to be noticed. They may act dramatic or inappropriately in order to receive attention. People with this disorder often do not realize that their behavior is problematic, so it can be difficult for the individual to seek help, especially if they tend to exaggerate their feelings or dislike routine. Treatment for this disorder usually entails therapy, specifically talk therapy, to help the individual see their motivations and fears that are associated with their behavior so that they can interact with others in a more positive way. There is a common myth that people with this disorder are incapable of leading normal lives. However, with the correct treatment and support system, it is possible for a person with HPD to live a completely normal and fulfilling life. The final disorder for this video, narcissistic personality disorder, or NPD, is classified as a disorder where the individual has an inflated sense of self-importance and a need for excessive attention or desire to be admired. Similar to HPD, talk therapy is the main treatment option for these individuals. A common societal stereotype about people with NPD is that they are only capable of caring for themselves. However, this disorder prevents the individual from forming meaningful connections with others, making it difficult to maintain relationships. It is pretty common to hear the word narcissistic being thrown around in today's world, but it is important to remember that people who do suffer from NPD struggle with it daily, and normalizing the term can make it harder for individuals to seek help. Before we end today's video, remember that personality disorders are extremely complex and can be serious. With access to treatment and support, individuals with Cluster B conditions can help manage their lives and improve their relationships. Antisocial, borderline, histrionic, and narcissistic personality disorders are things that many live with, so it is important to display our humanity and show empathy and kindness to others, rather than harsh judgment.